I'm Jessica Minton for IB Times TV, and joining me today is Dr. Reza Ghorbani, and he's here to talk about his new book, The Secrets to a Pain-Free Life. Now, thank you so much for joining me and taking the time to come all the way here to New York.
Thank you very much, Jessica.
Now, with everything that has been going on with Obamacare in the news and the Affordable Care Act, you're talking about the secrets to a pain-free life and how employers can use some of this knowledge to help their employees. So can you talk a little bit about the chronic pain that does go on in the workplace right now?
Absolutely. Jessica, chronic pain especially, is a major problem. My practice has even doubled in the last 5 years. About 100 million people in the U.S. suffer from chronic pain, and it's a costly problem as well. And that be translated into the workplace as well. Acute pain can turn into chronic pain, and chronic pain can lead to anxiety, depression. It can affect your relation with your family and friends, and can lead to disability. As a matter of fact, pain is one of the #1 causes of disability in the United States. And the cost of that is being passed on to the employee as well. For example, somebody gets injured at work. The next thing you know is these patients, unfortunately, are not treated properly, and the cost of healthcare can go up because of not having the right treatment at the right time. One of my old mentors always used to tell me that you have to have a right diagnosis, a right treatment, and the right timing. And if you have all three, then you can have a great outcome. Otherwise, it could be very, very difficult. With the Obamacare that you mentioned, first of all, it has to be implemented. After it does get implemented, we have to see actually by increasing access to a healthcare provider, does that fix the problem? One of the things that I like about the Obamacare is that they talk about prevention. And prevention is very, very important. In my book, Secrets to a Pain-Free Life, that you have a copy of it over there, we go into depth about how to prevent certain things that can lead into chronic pain.
Now, how many Americans suffer from chronic pain each year?
Well, the latest statistics is about 100 million people are suffering from chronic pain. And that doesn't even include children and some other fractions such as military.
Now, how much are Americans spending if they do have those chronic pain problems?
Well, Johns Hopkins recently had a study which they looked at that. And what they found is people who have chronic pain, they spend on average about $4,500 more than people who did not have chronic pain for their health care during that year.
Now, that's how much Americans are spending, but when it comes to employers, how much are they spending if they do have an employee that has a problem?
Well, that's again, it's in billions of dollars that the employees are spending. As I said, it could be directly that people are not coming to work or paying their workman comp insurances because people are getting treatments for years and years. And it's interesting enough, people who are injured at work, and I see a fair number of them in my medical practice, they rarely go back to work after their injury. And they're looking at the studies why that happened. And my belief is that because these workers are not getting early treatment or the right treatment at the right time. And that's what's causing this acute pain turning into chronic pain. And I go with that into depth in my book. How it's important for clinicians to also do early interventions. Sometimes, again, I see patients who come in that they've been injured at work, they lifted something heavy, and they have back pain. They end up having the same type of treatment, such as physical therapy, for months and months, but they're in pain and they can't do the physical therapy, so they're really not compliant, or they can't push themselves to get better. So what we believe in as a pain management specialist, to manage their pain properly so they can do their physical therapy, for example, and that could actually lead to a better outcome.
And finally, when it does come to Obamacare, there's a lot of controversy when it comes to businesses, whether that will help or hurt businesses. When it comes to chronic pain, how does Obamacare impact employees as well as businesses? Is it helpful or hurtful?
Well, again, the jury is still out. One of the issues with the Obamacare is a lot of people who didn't have insurances, now all of a sudden they have insurance. But those people who have now insurance, are they still going to have the same amount of access to the physicians? Because we haven't increased the number of physicians, we haven't increased the number of the hospital or institution. We also haven't changed the culture and understanding of physicians and patients when to seek treatment and what kind of treatment they should seek.
Well, Dr. G, thank you so much for your insight and joining us today.
Thank you very much, Jessica, for having me.